Hi, I'm Michael Gorton, the Chair of Wellways, and I'm excited to welcome you to our 2023-24 Annual Review video, right here in Frankston, in the southeast of Melbourne alongside Port Phillip Bay. And with me is our CEO, Laura Collister.
Thanks, Michael. Together we will share an overview of the many things that have happened over the past year. Just as a quick sneak peek, we have proudly graduated new mental health workers, making steady progress in growing the much needed workforce in our sector. We have completed our biannual staff review, telling us that our team at Wellways are more engaged than ever. And we've also grown our services, welcoming new team members to new regions. And we have had 2 large-scale public events that you'll hear more about in just a few minutes.
And we've also found a new way to implement lived experience leadership at the highest level through our Lived and Living Experience Authority. But let me first reflect on the place that Laura and I are meeting on today. We're here in Frankston, where our new mental health and wellbeing local delivers vital services to the local community. And I would hereby like to acknowledge that our important work happens on the land of the Bunurong and Woonwurrung people have cared for long before we were here, and that they are the traditional owners and the original custodians of the land. And I'd like to pay my respect to their elders, past and present.
Thank you, Michael. I would also like to recognise the contribution that is made by people with lived and living experience, whether they are employees, participants, carers or family members. We are committed to an inclusive community, workplaces, policies and services for people of all backgrounds, genders, sexualities, cultures, bodies and abilities. For today's look at the year that was, 2023 and 2024, we've decided not to do all the talking, but hand the mic over to others who are much better placed than us, the people delivering services and the people receiving services.
And to do so, let's watch some of the highlights together. One of the most profound changes over the last year was the way Wellways is governed. The board and I now sit alongside the newly established Lived and Living Experience Authority to ensure that the voice of lived and living experience is central to all decision making at Wellways. The authority will influence organisational values and improve how we do business. It will impact strategic direction, planning, policy, culture, budget, advocacy, research priorities and performance. In fact, the authority will have its own annual review video that you can find on our website, wellways.org.
In addition to the changes we've made at a governance level, we've also made significant progress when it comes to reconciliation. Not only is reconciliation paramount to our work across the entire organisation, but after the failed Voice referendum, it was all the more important to charge ahead and to signal Indigenous colleagues and participants that, now more than ever, we are steadfast in our commitment to walk with First Nations people on a journey to a fair and just future. What does that mean? Our Reconciliation Action Plan, our RAP, has made significant progress. Let's hear from our RAP officer, Jamie Lee Lallick, a proud Bundjalung woman.
My job here at Wellways, I'm the National Reconciliation Action Plan Officer, so I look after the RAP. I also work with the First Nations Caucus. I run the RAP committee. I work with external stakeholders, different government bodies, anything to do with reconciliation and First Nations work here at Wellways, I'm lucky enough to be involved with.
It's so good to hear directly from Jamie Lee about the progress our Reconciliation Action Plan is making and to see how cultural integrity training can be delivered. And in the coming months, every Wellways team member will receive this vital training because at Wellways, reconciliation is everyone's business.
Absolutely, Michael. The footage we just saw was captured at our First Nations Caucus Summit that takes place on country once a year and has become a calendar highlight for many of Indigenous team members. Speaking of calendar, there was a new addition this year, the inaugural Carers Week breakfast. As part of Carers Week and our service delivery of the Carer Gateway, we've invited carers and partner organisations to join us for a very special breakfast in Brisbane. What a wonderful event the inaugural Carers Week breakfast was. Speaking of Carer Gateway, many other things have happened too.
Well, absolutely. To make even more Carer Gateway services available, we've also brought in new community partners who deliver specialist services for carers, including Kookaburra Kids, a fantastic organisation focusing on young carers, and The Park, who are Parkinson's disease experts, just to name a few. But we've also spent more time with our Carer Gateway consortia partners, Selectability, Little Dreamers, Dementia Australia, and North and West Remote Health. In fact, our new carer podcast, Tune In to Care, features some of our partners, and this year, in season 2, we hear from the different carer groups we work with, such as First Nations, mental health, and young carers. So don't forget to listen to Tune In to Care. But on the ground, we've also met with partners to fully understand how we can better align our services, especially in rural and remote areas. So let's hear from Ash and Rima.
We have our Wellways team here to show them around the communities that we deliver the services in, and I think that that will help them to gain better understanding of the communities, especially the remote communities.
Something really great that we've learnt from Northwest Remote Health is how they tailor their services to meet community needs. As transport is quite a barrier to accessing services, North and West Remote Health have a bus that they would pick up everybody on and go out to some sort of activity, and they would have their sort of in-person peer support group on the bus, the conversation, they would go out, they would have their activity. I think there's quite often counsellors and coaches that might attend as well, so they can still have that sort of one-to-one service during the activity, but they still get that sort of peer support element as well.
There's a lot happening in remote areas of Australia, especially in Queensland as part of our Carer Gateway services. And now I'm proud to say that we now also have a voice on the Queensland Carers Advisory Council, and that we collaborate ever more closely with carer peaks such as the RAFMI and Carers Queensland. Together we can advocate with impact for systemic change.
And standing up for what we believe in is one of our goals as an organisation. And in this very spirit, our advocacy team has been busy organising a very successful Woodcock Lecture in 2024. From a new venue and available online across the country, the topic, Understand Trauma, Understand Mental Health, led to many discussions during and after the event, especially to answer the question, how to balance individual lived experience with sector and clinical expertise.
I really do have a vested interest, and just how then I apply that to how I practice with the people that I support.
I'm hoping that the conversation moves to trauma practicing, so really wanting the application.
Well, as far as trauma is concerned, I love the idea of healing rather than treatment, which is what they talked about tonight.
I've heard Maggie Toko speak before, but I had never heard her story the way I have tonight. It was so enlightening to truly listen to this experience.
Wellways has also significantly increased its supports to prevent suicide in the community over the past 12 months. In addition to our active work in New South Wales, we are now part of a large consortia led by each to deliver suicide prevention services. And further north in Cairns, we deliver the Way Back service, and we also lead new universal aftercare services in northern Queensland. In Mackay and Townsville, we are now running suicide prevention action planning, a networking initiative that brings together everyone who works hard to prevent suicides in those tightly knit communities. Let's hear from Zenta, who runs the suicide prevention service.
When I meet people now, I tell them that my role is to do with suicide prevention. They look a little scared, so Sometimes I say that my job is life promotion. Life promotion invites a conversation. People ask me what it is and I hear the most wonderful stories, the most wonderful experiences. I meet new people. I find out new places that I have to go to and services that I connect with. I'm Zenta. I work for Wellways here in Mackay. My job is to work within suicide prevention and connecting the community. Volunteers make the world go round. Especially in Mackay, there are so many wonderful people that have a day job but give so much time and energy to organisations like Grapevine and Real Mates Talk to support what is going on, especially raise awareness of suicide prevention, to encourage people to have those conversations and look out for each other. There is so much work that's already happened in Mackay and we're such a lucky community. I want to build on what's existing here, share it with the world to make sure that we're growing, evolving and doing what needs to be done for those that are in crisis and really need help.
Suicide Prevention Action Planning, now run by Wellways in parts of North Queensland, is an initiative that shows how crucial partnership and collaboration is on the ground and in community. Further south in Queensland, on the Sunshine Coast, Wellways has won the lead contract for a new Medicare mental health centre, which includes sites in Rockhampton, Gladstone and Bundaberg. Together with our partners from Clarity Healthcare, we're currently setting up these new services and we even made it on the news.
A new service has opened on the coast offering free mental health support. The more than $10 million facility is hoping to break down barriers for those trying to access help.
It may look similar to a GP clinic, but this centre is solely focused on providing mental health support, and anyone can access it free of charge, no appointment needed. The temporary facility will be based on Wises Road in Maroochydore until a permanent location is secured. Patients can be directed to the right support services for them, whether it be psychologists or other support services.
New services are going live as we speak. In the Sunshine Coast, we are establishing the Medicare Mental Health Centre in partnership with Clarity Healthcare and the Country to Coast PHN. And in Western New South Wales, we partner with Stride to deliver the Medicare Mental Health Centre. And not only did our services make the headlines in Canberra, there was a very special anniversary event that had to be celebrated.
The Canberra Mental Health Program has reached a major milestone, 15 years of helping locals during their darkest hours. Past and present patients joined the Step Up, Step Down team to celebrate the achievement. The Wellways program has made a difference to more than 600 lives since it was started in 2009.
I still use some of the strategies that I learnt when I was here in my everyday life now, almost 4 years later.
It provides a home to patients for up to 3 months as they transition from the hospital back to the community.
15 years of Step Up, Step Down. Well done, ACT team. Across the border in country Victoria, we're proud to, alongside our partners, open up another 4 mental health and wellbeing locals. These are located in Mildura, East Gippsland, Greater Shepparton and in the Yarra Ranges. This now brings the number of Wellways-led local services in Victoria to 6. They've been co-designed and are already playing a transforming role in the way mental health services are delivered. And earlier in the year, we've also opened our Benalla site. Let's take a glimpse.
We are so excited to be launching the Benalla site of the Mental Health and Wellbeing Local today. The team have worked immensely hard to integrate our service into community, and with feedback from our community consultants, we are launching this custom co-design site, which we hope everyone feels safe and welcome and aim to recover in a supportive space when they come to join us.
I've lived in Benalla for an awfully long time, and I know from past experience that mental health has not been well looked after by any means. So I've been here for nearly 50 years, and in that time I've seen lots of occasions where people desperately need help and there's been no one to help them. So thank goodness this facility is here now to help Benalla and District.
It's so wonderful to see these supports become available, and every time I attend these openings, I am amazed by the way these new local services are embraced in the community. As part of the mental health reform, we did not only open the new local services, but also Mental Health and Wellbeing Connect centres, supporting families, carers and kin. While one is about to be opened in Geelong later on this year, we've already had the pleasure to cut the ribbon on our brand new site in Traralgon in Gippsland.
When the Mental Health Wellbeing Connects were first being tendered for, I said to Laura and the team, this is what we want for Gippsland.
Traditionally, families and carers have not really been users of mental health services in their own right. They're generally there as supporters of other people. So this is a great moment in history.
It's just so fantastic seeing the centre come from this tiny little nub of an idea with all of the co-design that's happened to create these wonderful places for people.
There is so much happening across all of Wellways, and as the board chair I'm particularly proud that we've progressed towards the targets we've set ourselves as an organisation in our strategic plan. And it's fantastic to see that our 4 goals are being worked towards across the organisation.
I couldn't agree with you more, Michael. And this year, we also have fresh data that tells us that our team here at Wellways is more engaged than ever. Our recent all-staff survey told us that 94% of employees find their work meaningful, and 77% say that Wellways is a truly great place to work. This data has increased over the past 2 years.
But with honesty being our first value, we now also know where we can improve. Our communications and change management will have to get better. We will also provide more and better training, and we also expand the performance and career development opportunities that are already in place.
Absolutely, Michael. Making our work culture even better will be an absolute focus for the next 12 months. And we've already started. All of our teams have developed action plans together to work precisely on the areas that need improvement.
And I would hereby like to thank the close to 2,000 people who have made Wellways their preferred employer of choice. Team members who go above and beyond to deliver services and to make Wellways an even better place to work over the next 12 months, all guided by the voices of lived experience.
I couldn't agree with you more, Michael. If you want to find out more about the year that was at Wellways, simply visit our website, wellways.org. And Michael, I think it's time to look towards the future. And who would be better to do so than the future mental health workers who have graduated this year, right here at Wellways. A big congratulations to everyone.
Hi, I'm Tom. I work here at Preston Park as a trainee on the Earn and Learn programme, which has been an awesome way to get paid while studying and learn while I'm on the job too. You know, you learn a lot about yourself and you learn a lot from them as well. It's not just you are there to help someone else, it's very much you're sharing your humanity with someone as well, which is a really powerful thing, and you learn a lot from them as well. Yeah, so coming towards the end of the traineeship, looking at opportunities within Wellways, I've had some discussions with people where that is an option as well, but also further down the line I might look at working, completing a Master's of Social Work. To anyone considering applying for a traineeship, I would say absolutely do it. It's really awesome to be involved in mental health and be around people all the time, and to be able to be someone that can help somebody along their way to them creating a better life for themselves.